Before we begin, hit like, subscribe, and ring the bell. This is a story about a rescue dog who wouldn't stop sniffing her owner's face and how that obsession changed the course of their lives. Stick with us. It's worth hearing every moment. Lauren Gauthier kept a life of tidy compartments, morning runs, court dockets, meetings across town. At 42, she'd built a career on preparation, yet there was a softer corner of her day she never scheduled, the late-night ritual of settling with Victoria, her 2-year-old mixed-breed rescue, on the couch. Victoria had come from a shelter 6 months earlier, a scrappy, affectionate dog with a knack for perking her ears at odd moments. The two fit into each other's routines with a familiar ease. The change started almost playfully. A tiny red bump appeared at the bridge of Lauren's nose, maybe the size of a seed, and she brushed it off as a stubborn pimple. Victoria, however, didn't leave it alone. She would curl up within inches of Lauren's face and sniff obsessively, paw at her chin, and sometimes place her whole snout right against the bump as if trying to understand it. At first, Lauren laughed and showed her friends a short clip. "She's obsessed with my beauty regimen," she joked. Marissa rolled her eyes on video chat and teased, "Maybe she's jealous of your contouring." But the obsession deepened. Victoria's interest wasn't intermittent, it was steady and sensible. When Lauren tried to blot the bump with concealer, Victoria winced in a way that seemed almost like displeasure. When Lauren applied ointment, Victoria watched the whole process with a solemn vigilance that made Lauren uneasy. It moved from charming to unnerving in a span of days. One chilly Sunday morning, Lauren noticed the bump reddened and crusted just a little. She called her sister, half expecting a shrug. Her sister said the obvious, "Go to the doctor." But Lauren, who'd postponed doctor visits for work and deadlines before, found reasons to delay. The calendar, the billable hours, the embarrassment of being called overcautious. Victoria, of course, had no such hesitations. Night after night, Victoria would wake Lauren with a gentle paw to the face, nudge her chin, and then sit very still as Lauren inspected the skin in the bathroom light. Once, Lauren found herself watching Victoria watching her, and there was something almost pleading in the dog's eyes. That look nudged at an unease Lauren couldn't name. On an idle Tuesday afternoon, while Lauren scrolled through the news between clients, an article caught her eye. "Dogs and the Nose for Cancer: How Our Pets Can Detect Disease." It was a short piece with clean science. Dogs can detect volatile organic compounds produced by cancer cells. Trained dogs had found cancers early in some studies. Lauren felt a small, growing unease, the kind that sits low in the stomach. She set down her phone, watched Victoria sleep, and realized she couldn't ignore the dog's behavior any longer. She booked a dermatologist appointment for the next day. Dr. Henry Monroe was a dermatologist with decades of practice and a soft bedside manner. He examined the lesion under magnification and listened as Lauren explained how Victoria had been fixated on the spot. He nodded in a way that suggested he'd heard stranger things, then recommended a biopsy. Better safe than sorry. "It's a simple procedure," he said. "We'll know more once we test." 3 days later, after a morning of anxious pacing and a sleepless night, Lauren received a call. The words came slow and careful. The biopsy showed basal cell carcinoma. Dr. Monroe's tone was steady. It's usually highly treatable, but that steadiness didn't blunt the shock. Cancer. The word rolled around Lauren's head like a stone. He recommended Mohs micrographic surgery, a precise technique that removes cancer layer by layer while sparing healthy tissue. The plan would also likely require reconstruction, especially given the lesion's spot on the nose. Lauren's world narrowed to a corridor of appointments and phone calls. She found herself packing a small bag for the clinic and thinking about the petty things that suddenly felt urgent. Who would water the plants if she was in surgery longer than expected? She texted Marissa, who replied with a stream of supportive emojis and a promise to bring dinner. Victoria, as if sensing the tension, glued herself to Lauren's side and slept with her head on Lauren's lap. It felt like a steadying weight. The day of the Moz procedure, Lauren felt equal parts dread and relief. The surgeons removed tissue, checked margins under the microscope, and came back to say they needed to take a slightly larger area than expected to be certain all cancerous cells were gone. "Sometimes it's more than we expect," the surgeon said. "We'll reconstruct. We'll make a plan." Later, when Lauren first glimpsed the immediate post-op mirror, the reaction she could not have expected escaped her: a raw, guttural scream. The skin shift looked unnatural. Part of her nostril was lifted and swollen, a patch of skin rearranged to cover the wound. It was medical, and it was also profoundly disorienting. The nights that followed were a study in small mercies. Pain meds dulled some of the shock. The dressing changed regularly, and hands, kind nurses, the reconstructor surgeon, worked carefully. Victoria refused to be leaving Lauren's side. She slept on the rug, woke at the faintest movement, and nudged Lauren as if to say, "You did the right thing." Their bond deepened, not just by crisis, but by the constant small acts of attention. A lick, a warm head on a knee, a little tail thump when Lauren managed a laugh. As the swelling decreased and stitches dissolved, Lauren slowly began to tell the story to people she trusted, friends, a few colleagues, and then a broader group when she felt ready. She posted a candid update online, a carefully framed photo, a short note about early detection, and a soft thank you to anyone who had urged her to go. The response was immediate. Messages arrived from people who'd postponed skin checks, from those whose own pets had reacted to lumps, and from a few who had lost time to avoidable delays. One day, an email came from a research group studying canine scent detection for skin cancers. They'd seen Lauren's post and asked if Victoria would participate in a pilot study. The ask felt surreal. Victoria, a rescue, could help science. Lauren said yes without hesitation. Over the next months, Victoria took part in controlled trials where researchers measured her reactions to samples taken from lesions and benign skin. The work was careful, sensitivity checked, and ethically reviewed. Victoria's behavior, the same persistent sniffing and gentle pawing that had worried Lauren at first, registered on the researchers' charts as meaningful. Meanwhile, Lauren's healing continued. The reconstructed nostril softened with time. The raw edges became a lighter line. She met with a reconstructive specialist who explained, kindly and frankly, how scars mature over months and years. People often fixate on immediate outcomes, he told her. The body remodels itself. Lauren learned patience as a new skill. She also learned to speak about the experience honestly. The grief at seeing her face altered, the gratitude at having been spared something much worse, and the odd new pride in the scar that marked survival. Victoria became, in small public ways, a symbol of vigilance. At outreach events, Lauren would stand with the rescue dog at her side and say plainly, "Listen to your animals." She encouraged people to have lesions looked at and to think twice about tanning beds. At a local shelter talk, she met a woman who said, "My terrier nudged at my mole for weeks. I thought nothing of it. Now I'm getting it checked." These words felt like small ripples of change. The research took longer than anyone hoped, but results suggested a promising trend. Dogs, both trained lab canines and attentive household pets, could detect scent signatures associated with certain skin cancers more often than random chance. Victoria's behavior became part of that data set. Researchers were careful to note limitations. Not every dog would behave this way, and human screening and diagnostics remain essential. Still, Victoria's instinct had become a piece of a larger puzzle. Months turned into a year. Lauren learned to catch the scar in the mirror and not look away. She documented checkups and follow-ups and spoke at a conference. Once terrified of speaking to a crowd, she now stood before clinicians and advocates and told them about the dog who kept sniffing. The room listened. People clapped. Victoria, older by a year and calmer in her gray-muzzled face, wagged and leaned into Lauren's legs like any loyal companion. If there's a simple line to draw through this story, it's this: attention, even animal attention, demands an answer. A tiny nudge from a dog led to a biopsy, which led to removal and healing. Small choices saved a life. Lauren sometimes thought of the tiny decisions that had stitched the timeline together. A stray article read at a pause between calls, the phone call to the clinic, a rescue dog adopted on an impulse months earlier. The sequence felt miraculous only because it was made of small, intentional acts. On sunny afternoons, Lauren and Victoria walk now along the river, their pace unhurried. Lauren's scar is a pale line that catches the light. She has fewer excuses to delay appointments, and she tells the story whenever it might matter. At outreach events, she meets people who share their own dog-saved anecdotes, and others who say simply, "I checked." That is enough. If your dog suddenly fixates on a body spot, consider listening. It might be nothing, and it might be everything. If this story moved you, share it. Leave a comment about a pet who watched over you, and subscribe for more stories about the quiet ways animals make us better. Thanks for watching. Light the lantern. Join the journey. Subscribe.